Premiumbeat.com.
Sickle cell anemia is a genetic disease that affects hemoglobin, the protein that carries oxygen in the blood. Normal red blood cells are very flexible, circular in shape. This allows them to move freely in the blood vessels. In persons with sickle cell disease, the red blood cells become crescent or sickle-shaped and inflexible. The abnormal cells get stuck, clump together, blocking the blood flow. Sickle cell is an inherited disease. If both parents have sickle cell trait, there is a 25% chance that any child of theirs will have the disease. Symptoms of sickle cell disease include severe pain that is sharp and intense. This occurs without warning when sickle cells block the blood flow and decrease oxygen delivery. Painful swelling of the hands and feet, also very common in sickle cell disease. The breakdown of red blood cells causes a yellow color skin known as jaundice. Some children may get fever when they are exposed to bacterial infections. Tiredness is common in sickle cell disease because there are not enough healthy red blood cells to carry oxygen throughout the body. There are certain factors that lead to frequent pain episodes. Excessive physical exercise causes shortage of oxygen, and this causes the red blood cells to sickle. Exposures to hot weather and not drinking enough water cause the blood becomes thicker and the sickle cell stick together, blocking the blood flow. Everyday stress from things like exams can trigger sickling crisis. Children with sickle cell disease are at more risk of infections. Exposure to bacteria and viruses cause changes inside the cells that lead to sickling of red blood cells. Exposures to cold weather causes narrowing of the blood vessels, making it hard for the red blood cells to flow. Improving the physical health of children with sickle cell disease is important. Pain negatively affects the physical health of those children. Pain episodes could be prevented by drinking 8 glasses of water per day, wearing warm clothes in cold weather and when exposing to a cold environment. Prevent the child from getting stress. Help the child to relax by watching favorite cartoon, reading a story, or listening to Quran. Prevent the child from climbing mountains or high places because high altitude reduces oxygen in the red blood cells. Help the child to maintain a high level of cleanliness. Encourage the child to wash hands with soap. Wash fruits and vegetables, and keep the child away from crowded places. When the child experiences mild pain, give Tylenol or ibuprofen. Rubbing and applying of heating pad to the painful area. Give the child extra 2 to 4 ounces of water to stay well hydrated. If the pain increases and becomes severe, take the child to the emergency room. The doctor will prescribe morphine to the child to reduce his pain. To stay well hydrated, the child will be put on intravenous solution. If the hemoglobin is less than 10 grams, blood transfusion will be started. Children with sickle cell disease are prescribed hydroxyurea drug. This drug helps to increase the production of new hemoglobin, known as fetal hemoglobin. It also complications of sickle cell disease are different for each child and can range from mild to severe. Pain is the most common complication of sickle cell disease, and the top reason that children with sickle cell are taken to the emergency room. Acute chest syndrome is a chest infection. The child experiences a severe chest pain, coughing, difficulty in breathing, and fever. The child may have a swelling in the hands and feet. This is known as a hand-foot syndrome. When large number of sickle cells get trapped in the spleen, it causes the spleen to get enlarged. Other complications for sickle cell disease are anemia, stroke, infections, and organs failure.
PremiumBeat.com. 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 SCD
painful swelling of the hands and feet is also common in sickle cell disease.